Good morning. I'm Dr. Matthew Ngetich. I'm a general practitioner with 20 years experience in various capacities, both as a clinician, an administrator, and a manager of schemes themselves. I'm passionate about managed healthcare systems which are going to deliver quality, affordable healthcare services to all Kenyans. This ties in nicely with what we are trying to do at Ponea Healthcare, where we actually are putting the patient at the center of healthcare. What is the burden of cancer in the world, Kenya in particular? Now, the biggest cause of death worldwide is cardiovascular disease, diseases like high blood pressure, followed by diabetes, and then increasingly cancer. We are seeing this a lot, of course, in the first world, and we are also starting to see the same trends occurring in the third world itself. This is especially so if you look at urbanized societies, which are very similar to what we actually have in the first world themselves. When you are in the capital, Nairobi, you're basically living a first world experience. So your risks are very similar to what you'd find in Europe, for example, the Americas themselves, and in the Far East. And in those places, the diseases that people are dying from are the non-communicable diseases, of which cancer is one of them. 70% of cancers, unfortunately, occur in the countries that are least capable of managing them. And these are the low and middle income countries, of which Kenya is one of those. In the first world, for many people, cancer is not a sentence of death because, first of all, they've got systems to, one, educate the public about them so that people are aware that there's this disease and they look out for it. I liken it to being told that there's a lion walking around your compound or in your neighborhood. You are then going to take necessary precautions before you leave your house to ensure that you do not have an encounter with that. But if you are unaware, you will be caught out there and you'll become a victim. Two, they've got systems to actually detect these cancers. You may have heard of the expatriate community actually going out of their way to travel back to their countries of origin to go and see their doctor. In Kenya, we don't have that. Many of us have got this attitude that we wait for an illness to actually come at our door, and that's the time that you actually get out of bed and you go to hospital. At times, it's too late. It's like sending your child to school and waiting for them to actually go to university. You have not bothered to follow up on their timely reports. You've not bothered to follow up on their yearly examinations themselves. You do not know their weaknesses, their strengths. Are you surprised then when they get a poor score? Many of us spend a lot of money and our time servicing our cars. On a typical weekend, you'll see very many of the middle class actually going out to their garages to fix their car. Or if they're going on a long trip, they fix their car. But ask yourself this: when was the last time you went out of your way to service yourself, the most important assets in that motor vehicle itself? When was the last time that you actually looked out for your partner? When was the last time you looked out for your dependents? What about your parents? Have they ever gone for this test that might have detected cancer in the early stages? Many of us will answer no, but we spend a fortune on our vehicles, we spend a fortune on our electronics. Your phone, the battery is going down, you replace it very quickly. What about yourself? Now, again, poverty plays a big part because quite a number of these tests, these interventions, of course, it require resources. And in Kenya, we are very poor. But these tests that we actually want you to actually go and do to detect cancer early are cheap compared to the cost of the management of advanced cancer and even the cost of early management of cancers themselves. Thank you for joining us for this session. I'm Dr. Matthew Ngetich. We look forward to having you on our next session when we're going to be discussing any other health needs that you might have. If today you wish to discuss more about cancer or the myths that surround it, or you have any particular health needs, do feel free to reach us on ponea.com. Asante.